going to get patients to remember to come back to you? It may sound silly, but how is it that you can stay top of mind for people that have come to your practice? Everyone's busy. They forget. I forget what I ate for breakfast. Actually, I think I forgot to eat breakfast. So it's very easy to not be so focused on these things. It's your practice, so it's very much in the forefront of your brain. But patients who have come to see you last week, last month, last year, how do they remember to come back? In this video, I will break it down for you. Hi, I'm Dr. Annie DePasquale, the owner and founder of Collaborating Docs. We help entrepreneurial nurse practitioners connect with fabulous collaborating physicians. So how do you stay top of mind for the patients who have come to see you in the recent past, or maybe even the distant past? It's not going to be magic, right? Like, you need to do something to actually remind them. And in the healthcare space, we're lucky because we do collect a lot of data on our patients: their email address, their phone number, and their home address. So those three things are your ammunition for staying in their mind. So let's do email first. The easiest way to do email is a weekly, bi-weekly, or at least a monthly email from your practice to your patients. And it's going to be value, helpful things, health advice. It's not, come see me again, I miss you, come back, we need to see you. None of that, not at all. You want it to be, if you do that, they're just going to unsubscribe and mark you as spam and be annoyed. So make it, hey, summer's around the corner. Let's talk about sun protection, or, skin protection for summer, stuff like that. Okay, so that's email. A second part of email, though, I do want to add on is automated messaging that someone can help set up for you if you're not technical, after the visit, before the visit, following up after the visit. Like, there's so many touch points. So I have a young daughter who goes to this dentist in town, and I swear, leading up to her appointment, we're getting email, text, email, text to make sure we show up. And then afterwards, survey, how to go, feedback, tell us, emails, text, email, text. And then as it's time to schedule her next one, it's, hey, it's time, email, text. So that lady has it locked and loaded, I must say. She also has the most Yelp reviews for any pediatric dentist in a 5-mile radius. So she's doing something right with her outreach. That is for sure. So you don't need to be super crazy about it, but there's doing nothing versus doing what this lady is doing, the two extremes. So I think something in the middle, to make sure people make sure they're happy afterwards and remind them to come back. That can all be automated and should be automated. So that's email. Let's talk about home addresses. You can and should actually mail things to people, right? You can mail postcards, you can mail letters, but again, it's value. Maybe you send them a coupon. It depends on what type of practice you have. But if you're cash-based, coupons are great. If you are doing a special event in the community, let them know about that. So I would reserve, it does cost money, obviously, to send postcards and things in the mail. You might even want to sort of, we call it segments, or in the medical world, you could maybe say triage your list of clients or of patients and say, these are the people, these are the women that come for Botox every 3 months, like clockwork. Those are my highest quality, highest, I need to roll out the red carpet for them more than anybody else. So maybe you're sending them a holiday card or a New Year's card or something. So, or a little gift. Don't undercut the possibility of sending a token of your appreciation goes a long way as well. And the third one was, we did email, home address, phone. So phone, there are, obviously you can text people and call them if they have opted into that. So when you have a new patient, you may want to be sure you have the legal part where they're agreeing to be marketed to, be followed up to. It doesn't count for like calling with their lab result. You need to do that for anybody, regardless of what they, have opted into. But we're talking about like true marketing messages. Make sure they're okay with that. And there are things called voicemail drops. There's just literally calling and sharing messages. You might need to outsource that. It's probably not a great use of your time. So I'd say that's sort of like the least important of all. That's if you're doing everything else already, okay, maybe now look into voicemail drops and automated text messaging and that sort of thing. But for beginners, let's focus on email, numero uno for sure. And then snail mail is a second. And then the figuring out the phone would be really, I would say, last. So hopefully this gives you some food for thought, like, oh, I never even thought about sending my highest value client or patient invitation to our grand reopening event or the opening of our second clinic, or, these are things really your clients, everything should be poured into the clients you already have because you already have them. So hope you find this helpful, and I will see you next time.